To effectively manage psychotic disorders such as schizophrenia, a multidisciplinary approach is required. In addition to antipsychotics, when treating schizophrenia, other treatment strategies such as family intervention, cognitive behavioral therapy, case management, and addictions treatment are almost always necessary. Nurses play a key role in the recovery process of an individual with schizophrenia. They provide therapy and support to the individual and the family, and are often the link between patients, physicians, and the various health and support programs. With the physician, they play an increasingly important role in coordinating the healthcare and support services needed for the individual. The new recommendations provide specific areas where nurses can help implement a patient-centric approach to care for individuals with schizophrenia. Specifically, these recommendations highlight the need to support patients and their families to make an informed treatment choice. After all, a considerable proportion of patients with psychotic disorders may be totally unaware of the LAI treatment option. And patients with psychotic disorders are rarely given all available choices when treatment is initiated. The recommendations point out that the option of LAIs for antipsychotic therapy should be discussed with the patients and families at all phases of the illness, including the early phases. If LAIs are initiated in an involuntary hospitalization, nurses can lead a discussion with the patient and their family around the reasons for starting LAIs and their potential side effects. This can increase engagement and allow healthcare professionals to address any negative associations around treatment with LAIs. Achieving remission and sustaining it is critical to improving social and occupational functioning, especially in the early phase of the illness. Nurses can assess adherence and efficacy over the long term and consider how the current treatment choices may be altered to improve outcomes. This is especially important in the management of schizophrenia because the effectiveness of antipsychotics is undercut by non- or partial adherence, which is highly prevalent in patients with schizophrenia. In a study of patient attitudes towards LAIs, it was found that a considerable number of patients would accept a long-acting treatment option. Offering antipsychotic LAIs to more patients can narrow the gap between patients' acceptance and low prescription rates. Nurses play a key role in regularly discussing less frequent, once monthly, long-acting treatment options with patients and caregivers, and in recommending these options to the physicians upon patient acceptance. By administering and monitoring treatment and by using LAIs early and often, nurses are likely to reduce the impact of adherence problems in schizophrenia treatment. Through the use of LAIs, the discussion between nurses and their patients can center around recovery. Less time is needed to discuss issues related to medication management, and more time can be spent on exploring patient goals and aspirations.